switching immunoglobulin therapy. IVIg versus SCIg for primary immunodeficiency for individuals with primary immunodeficiency. PI, immunoglobulin IgG replacement therapy is vital for preventing infections and improving long-term health. This therapy delivers antibodies from donated human plasma, and it's typically administered in one of two ways: intravenous infusion, IVIg, or subcutaneous infusion, SCIg. Both methods are effective when used correctly, but the best choice depends heavily on personal needs and preferences. The core choice: convenience versus control. The primary reasons people switch between IVIg and SCIg aren't about efficacy. Both work well, but about how treatment fits into their lives. Cost, convenience, and side effects are the key drivers for most patients, as highlighted by Dr. Vincent Tubialo, an allergy and immunology specialist. The decision should be a shared one between you and your medical team. Understanding the shift to self-administration, switching from IVIg to SCIg means taking on more personal responsibility. With IVIg, infusions are handled by healthcare professionals in a medical setting. SCIg, however, requires self-administration at home after proper training. While this offers flexibility, it also demands managing supplies, monitoring for reactions, and ensuring consistent treatment. Expect comprehensive training from specialty pharmacies, with nurses visiting your home to guide you through the process. Typically, at least 3 supervised sessions are necessary before independent administration is expected. Maintaining a supply of medication, infusion tubing, needles, and antiseptic wipes becomes your direct responsibility. For some, this control is empowering. For others, it can be overwhelming. Openly discussing these concerns with your provider is essential. Side effects. What to expect. Side effects are a major consideration when deciding between IVIg and SCIg. IVIg is more prone to systemic reactions like headaches, fatigue, fever, and flu-like symptoms. In rare cases, aseptic meningitis, inflammation around the brain and spinal cord, can occur. Pretreatment with steroids, fluids, and antihistamines can help, but some patients still struggle to tolerate IVIg. SCIg generally causes fewer systemic side effects, but often results in local reactions at the infusion site: redness, swelling, itching, or bruising. Numbing creams can help mitigate discomfort, and reactions tend to lessen over time as the body adjusts. Treatment frequency and scheduling. IVIg is typically administered every 3 to 4 weeks, requiring a 3 to 4 hour infusion at a hospital or clinic. SCIg, on the other hand, is usually given weekly or bi-weekly, with sessions lasting 30 minutes or less at home. This flexibility makes SCIg attractive to those who cannot commit to lengthy clinic visits. Financial implications. Cost and insurance coverage are critical factors. IVIg administered in a medical setting is billed under medical benefits, potentially including facility and administration fees. SCIg is often billed under pharmacy benefits and shipped directly to the home, reducing certain costs. Generally, SCIg is less expensive, but out-of-pocket expenses vary widely based on insurance plans and prior authorization requirements. Non-medical switching, insurance forcing a change in medication, is a growing concern for both IVIg and SCIg users. Thoroughly review coverage details with your insurer before switching. Quality of life. The personal impact. Many people who switch to SCIg appreciate the increased independence and reduced disruption to their daily lives. Being able to schedule infusions around work, school, or travel provides greater control. However, some patients prefer the structured reassurance of clinic-based IVIg, especially if self-infusion causes anxiety. Dr. Tubialo recommends SCIg when possible, unless the patient is too ill to self-administer or has bleeding problems that make subcutaneous injections risky. Ultimately, involving patients in the decision-making process leads to better adherence and satisfaction. The bottom line is that the best approach is the one that fits your life, preferences, and medical circumstances. Editorial sources: American Academy of Allergy, Asthma and AMP, Immunology, CVS Specialty, Stat Pearls, Frontiers in Immunology, Immune Deficiency Foundation.